committee. This is not just a normal Tuesday. This is recognition day for the General Assembly. This is ownership day for the General Assembly. You know, I'm sorry that you're having to convene this meeting today because I'm sorry the state employees, the active and retired employees, have not been entitled to the prices that they deserve over the last few decades. I'm standing here as the State Treasurer of North Carolina, but we have a great staff that's working on the state health plan, and they understand who their customer is. The customer is the state employees and the retirees of the state health plan. Their loyalty and their duty of care is to those individuals. I was called last week by a senator who got visited by 5 different hospitals. And the person called me because it actually dawned on them after the 5th visit that they were all saying the same thing. But more importantly, he dawned on this particular legislator that this is y'all's problem. I just have responsibility for trying to fix it, and that's what we're intending to do. I see a lot of people in the audience, Mr. Chairman, but there are a lot of people who are not here. Number one is the State Health Plan Board, which is appointed by members of the Senate, members of the House, appointees from the Treasurer, and also the Governor's Office. That board passed overwhelmingly, unanimously, a resolution to support reference-based pricing. The other folks who may not be here are people who are no longer with us. One is Jim Valvano, and those of you who have taken the walk with me at the Oakwood Cemetery and have been by his headstone, on that headstone he says every day you're supposed to laugh a little, cry a little, and think a little. I think you'll probably be doing that over the next 1 hour. But I'm also reminded of what Coach K once said when they asked him about his courtside manner. He said, you know, there's some things that happen right in front of your eyes that are worth getting upset about. When you hear about the condition of the state health plan and what's been going on for decades, I think you'll be upset also. So at the end of the day, there are other people who aren't here, Mr. Chairman. Beth Wood, the state auditor, Les Merritt, the previous state auditor, who 7 and 10 years ago, respectively, had the finding of the state health plan. Even though the state health plan spends over $3 billion a year, the state auditors do not have access to vendor contracts and cannot independently verify that the state is receiving the proper contractual discounts. Doesn't matter what chamber you're from or what party you're a member of, I don't think anybody in this room wants the state treasurer paying bills when we don't know what the bills are for. Secondly is the Attorney General, who has been looking at this issue about steerage and anti-competitive practices over the last few years. Another person who's not here is Anna Matthews, who writes for the Wall Street Journal, who just did a report talking about the fact that what's going on with referrals of the state doctor practices is driving up the cost of health care. Another individual who's not here is former Treasurer Harlan Bowles, who issued this very report 39 years ago. And the finding of this report is the growth in the number of public sector employees and retirees and the runaway medical costs. This is 39 years ago. And the actuarial funding and retiring medical benefits will soon result in public sector obligations that will equal, exceed, and then dwarf the state debt. 39 years later, I'm here to report that the unfunded liabilities of North Carolina with the pension and the health care are nearly 9 times the state debt of North Carolina. On the health care side, that puts us at $30 billion. If you're interested in where $30 billion places you in the United States, according to Pew Research, it places you right behind the state of Illinois in terms of the severity of this problem. Now, no one wakes up thinking about unfunded liabilities and life expectancies and all these other issues. They wake up thinking about how we're going to best educate our kids, protect our citizens from crime, pave our roads, and all the other core functions of state government. But I can certify to you that unless we are able to take advantage of our largeness and give the state employees and the legislature the prices that it deserves in health care across this state, that money is going to be taken away for the next 20 years from things that you care about. Because every dollar that's spent on health care unnecessarily